ONA's Board of Directors focused efforts on achieving 4 broad outcomes in 2009. 1. Improve the lives of members. The board proactively led efforts to improve the economic status and working conditions for registered nurses and allied health professionals. In 2009, accomplishments in this area included the successful ratification of negotiated settlements for the following sectors: nursing homes, some community care access centers, and several public health units. The hospital sector agreement expires in March 2011. ONA continues its advocacy efforts for the community and clinic sectors. In September 2009, ONA's member research was completed with very positive results. The board continually seeks feedback from members. For instance, the annual Services Satisfaction Survey now includes an evaluation of support, education, and priorities. The board has strategies to evaluate the short and long-term goals for all sectors. The All-Sector Strategic Bargaining Project Team, Long-Term Care Project Team, and the Hospital Central Negotiation Project Team identify the goals achieved and where there are opportunities. The board works strategically to influence government legislation that affects our members. This includes obtaining standing at inquests, participating on task forces, stakeholder initiatives, and the submission of briefs. The board actively works with allies like the Canadian Federation of Nurses Unions, the Canadian Labour Congress, the Ontario Federation of Labour, the Canadian Health Coalition, and the Ontario Health Coalition on issues that will help improve the lives of our members. The Cutting Nurses, Cutting Care campaign seeks to protect job security for nurses and defend quality patient care.
When you need a nurse, will one be there for you? Concerned? Visit cuttingnursescuttingcare.ca.
The board regularly represents the interests of members through its work with the Ministry of Health, College of Nurses of Ontario, Nursing Secretariat, the Registered Nurses Association of Ontario, and Ontario's new Minister of Health, Deb Matthews. To preserve members' jobs and quality patient care, the Board of Directors has developed guiding principles for the application of the ONA Job Security Guide. The board aggressively defends the RN scope of practice by influencing government to increase permanent and sustainable funding for nurses and allied health professionals. ONA systematically tracks layoffs, vacancies, and decreased nursing positions and hours to clearly demonstrate threats to quality patient care to the government, the media, and therefore Ontarians. Health and safety also continues to be an area of major concern for the board. ONA's work is focused on broadening legislation so that all sectors have appropriate access to safety-engineered devices. ONA's efforts also ensure the mandated use of N95 respirators during the H1N1 pandemic. ONA provided valuable input into Bill 168, legislation regarding workplace violence. The board has shown active leadership in human rights and equity, including the running of a second very successful leadership development program in 2009. ONA's November 2009 Human Rights and Equity Caucus was a well-attended and highly rated event. 2. Increase member participation. The second broad outcome for the board focuses on achieving a thriving union through active and informed member participation. Indicators include continued positive evaluations from area coordinators meetings and provincial coordinators meetings. Increased use of ONA's website. Member feedback has also influenced the redesign of ONA's site, and the new student section is now part of the relaunched website. ONA works with members to develop leaders, both locally and provincially, for the future. Education in 2009, an increase in attendees, successful video conferencing for Region 1, and planning for new educational opportunities in 2010. The board has a strong commitment to the Canadian Nursing Students Association and the Students Affiliate Program at ONA. Local leaders have been encouraged to actively engage with Ontario Region members of the CNSA in events and activities. The board, in turn, continues its outreach to the CNSA's Ontario region, making presentations to nursing schools and by providing incentives to engage younger members using the Johnson Funding for Education. The board regularly reports back on teleconnects between ONA and CNSA leaders. Students have attended provincial coordinators meetings by invitation, and CNSA members are now being invited to area coordinator conferences. A very positive sign of increased member engagement is the rise in bona fide membership to more than 90%. 3. Engaging local leadership and members in the union. The third major outcome of the Board of Directors is to help the leadership of locals and bargaining units to be actively involved in the work of the union. ONA's president and first vice president attend local and bargaining unit meetings when available. ONA vice presidents continue to meet with frontline members in their respective regions, and the board continues to play an active role at area coordinator conferences. The tools developed for member feedback are now getting positive reviews. They include ACC and PCM reportbacks, a local coordinator checklist, ONA videos, the union's local coordinator bargaining unit president manual. Board members are making site visits to bargaining units, especially during Nursing Week, and attending leadership team meetings when possible. The board is increasing the use of electronic communications to bargaining unit leaders. This work includes pilot projects on reducing mailings and increasing targeted email group lists. Member evaluations show a high rate of effectiveness for computer training education at provincial coordinators' meetings. The board has received positive feedback about the information contained in the CEO monitoring reports and in board and PCM highlights. Board highlights and minutes are sent after every meeting. Action plans are sent after every PCM. 4. Protecting the healthcare system. The fourth outcome of the Board of Directors is to advocate for our publicly funded, publicly administered, and publicly delivered high-quality, affordable healthcare system. The board works both locally and provincially and with allies to increase public support for healthcare. ONA continues to lobby for appropriate health funding with support from members, the public, the media, and member participation in local events. ONA produces and distributes a monthly political action calendar for members. Board members also participated in advocacy efforts on Parliament Hill with the Canadian Federation of Nurses Unions. The annual Toronto Labor Day Parade saw more ONA members calling for an end to nursing cuts. ONA members also participated in the Ontario Health Coalition's Health Action Assembly. Locals have increased their use of ONA funding for local political action and activities around campaigns such as Cutting Nurses, Cutting Care. The board strives to provide ONA members with an understanding of the negative impact of privatization on their work and patient care. Your ONA Board of Directors feels it is important to report back to members on progress, successes, and challenges in 2009. With your continued input and support, the board is committed to achieving its strategic outcomes in 2010.